So you got twin brothers. They both experience the same trauma. They were both raised in the same household. One develops PTSD. One doesn't. Why is that? Great question. Let's talk about it. Hey, my name is Dr. McCleary. I'm a licensed clinical psychologist and Navy veteran. My channel is dedicated to educating veterans, service members, and their families about PTSD and mental health. So if that's you, consider subscribing. So the age-old question of why does one person develop PTSD and another person does not is as old as the PTSD diagnosis itself. How come two soldiers in the same battle with the same experience, one comes out with PTSD, one doesn't? What's that all about? Well, the short and dirty of it is no one actually knows totally why. But what I'm going to give you in this video is 4 reasons why it might be, according to scientists. Before I jump into the reasons why a certain individual may develop PTSD, why somebody else may not, I want to mention that all of the symptoms of PTSD, to a certain degree, are normal. Yes, normal. After experiencing a trauma, yes, nobody wants to think about that. Nobody wants to talk about that. That's normal stuff. Having intrusive images or nightmares are just ways that our brain is trying to process things. That's normal stuff. Having a heightened startle response, it's normal. Having difficulties with your memory, concentrating, normal stuff. Changes in how you look at things, normal stuff. I want to make all that clear before we jump into the possible reasons why somebody develops PTSD. Because if you have symptoms within the first 30 days of PTSD, well, that's normal stuff. It's not until it gets past 30 days that you can even meet criteria for a diagnosis of PTSD. That's how normal the symptoms can be. Something to think about. The first theory of why someone develops PTSD revolves around the actual trauma and how much exposure to trauma. So some would argue that the closer you are to a trauma, the more likelihood that you will develop PTSD symptoms. And when I say closer to it, what I'm talking about is directly experiencing the trauma. So you can have PTSD from just hearing about it happening to a loved one. But some scientists will argue that the closer you are to the trauma, the more likely it is that you will develop PTSD. Another part of that is sometimes when people have experienced multiple traumas, maybe they had a trauma in childhood and then they got into the military and went to combat and there was another trauma. Sometimes scientists will argue that the previous traumas actually prime someone to have more PTSD symptoms. So basically what that is saying is when you have multiple traumas happen to you over and over again, most people don't develop a resiliency, although it might seem like that. They actually might be more predisposed to developing PTSD in the future, according to some scientists. If you are a neurologist or a neurosurgeon that is listening to this video or watching this video, Please forgive me for this oversimplification. But this video is probably not for you. The next reason why someone may develop PTSD is a dysfunctional amygdala. And the amygdala is a part of your brain that regulates emotion, regulates the intensity of emotions. Now that's an oversimplification, but why that's important with PTSD is some of the symptoms of PTSD are directly related to a regulation in emotion. So difficulty experiencing joy or happiness or love, well, that is a difficulty in the regulation of emotion. High anger or being easily triggered by things, that is another difficulty with emotion regulation. Being easily startled or always being on guard and feeling like you always got to look over your shoulder, that is a dysfunction in emotional regulation. So a dysfunctional amygdala can be related to PTSD symptoms. Now, and what we have found is with people that experience PTSD, they often have trouble in their amygdala. Now, do we know which one came first all the time? Not always. Did somebody have a dysfunctional amygdala, then they develop PTSD, or did they develop PTSD due to a trauma, and then we find out that they have a dysfunctional amygdala? Well, I think the studies are still out on that. But it is something to consider when we talk about treatments moving forward in the future. The next one is a little bit more tricky to explain, but I'm going to do my best. And that is having very negative attachment and very negative thoughts prior to a trauma. Maybe they were started during childhood. Maybe they started by not having a firm and healthy attachment to somebody's caregivers. Maybe there was abuse in someone's household. And then, maybe years later, a trauma happened or a series of trauma happened. And now, not only is somebody dealing with the post-traumatic stress symptoms of that trauma, but now they're also wrestling with those negative thoughts about maybe themselves, other people in the world that actually already existed prior to the trauma. So sometimes individuals don't develop negative thoughts about themselves, people in the world, post-trauma. Sometimes those thoughts already existed, and a trauma just concretes those thoughts that are already there. The last reason that I want to talk about regarding why some people develop PTSD and why some people don't post-trauma is avoidance. And if you watch any of my videos, you know that I talk about avoidance a lot. Basically, what I'm saying here is that with a trauma, often a trauma is a memory that has a very hard time fitting in with the rest of our memories. Often because it may be disturbing or painful. So often we go through a lot of pain and heartache just to avoid thinking about that trauma again. Now, some people will go far lengths to not talk about or experience anything that's related to their trauma. Now, what happens there, though, is that traumatic memory never actually gets a chance to get processed, never actually gets a chance to kind of run its course so it can get stored with the rest of the memories. and thus it gets stuck. And that's where a lot of the symptoms end up coming from, is not just a trauma happening, but someone getting stuck kind of in that moment of the trauma, because for whatever reason, that trauma has not been able to get processed. That is actually how a lot of the evidence-based treatments of PTSD are actually developed. They cause you to look at your trauma so you can process not just the image and emotions of the trauma, but also the thoughts related to the trauma. And once that gets processed, often people are able to put it behind them. Not forget about it. You'll never forget about it. There will always be a troubling memory. But what you can do is process it to the point where it doesn't have to interfere with your day-to-day life. Something to think about. So those are 4 ways or 4 reasons why some people develop PTSD and some people don't. There are more theories behind this, and all of them are arguably theories. The reason that these things are important to talk about, though, is it goes towards how we develop treatments and what may work for you. So if you notice why you might have gotten stuck somewhere with your trauma, you might actually be better fit to understand how to go about treating it. Something to think about. If this video was helpful for you, please like it or consider subscribing to my channel if you want to learn more about PTSD and mental health. But more important than that, if this video was helpful for you, then that means it can probably be helpful for another veteran or another service member or another friend or family member of a veteran. So I ask that you share it with them, because at the end of the day, that's really what all this is about. One veteran trying to help another.